So let's talk about the various root cause aspects of this. I think if I'm hearing you correctly, context matters. So there's an initial event that's
Mhm.
important, a response to that event, and then there's a multitude of reasons why these conditions may be maintained due to the way that they respond, the complexity to this. But from your understanding of the various kind of root causes to developing these symptoms that we label, what have you seen in clinical practice?
Mm. So it's wonderful that you're asking this now because I just prepared a talk for a conference. So I've been thinking about this in terms of stages. So I'm going to probably be drawing from this talk as I'm answering this question. For the majority of people, the simplest case is simply that someone developed a fear response to the symptoms themselves. Maybe they had a cold and okay, simple example. When I have a bad day and I come home and I'm really stressed out and someone slams a door, I'm going to jump really high. I'm going to be much more reactive than if I had a great day and someone slams a door. My system's already on edge. So when someone's system is already on edge because of just random life circumstances or just a little anxiety or, we had some losses or financial stress, whatever it is, and then they end up with a symptom that's scary for whatever reason, that in the backdrop of that, the brain can misinterpret the symptom as related to that backdrop of stress. And we end up looping in this cycle. So the remedy for many people is just calling its bluff and seeing that actually the sensation isn't dangerous. It's just the brain overreacting to normal sensory information or to a misunderstanding of sensory information. So essentially, what I teach people in this stage is just approaching the symptom rather than trying to avoid the symptom. So rather than trying desperately to stop the symptom, to Google the symptom, to go to doctors to fix the symptom, to mitigate the symptom by avoiding or complaining or lying down or hiding from it, which again is the most natural thing in the world. I say this with zero blame. The things that I've seen, the sensations people have, Roger, have been any person would be cowering in terror from these symptoms. But once people realize this is all of that is feeding into this fear cycle, when they stop doing that and they just let the symptom be, and they understand what I've already said about how your brain can rewire, your brain's always plastic, that's enough to undo the cycle. That breaks the cycle, and the brain can rewire itself so that it doesn't have this sensory distortion anymore. So that's kind of the simplest case. But the types of stressors people have, so I described simple stressors just now, financial stressors, what have you. The types of stressors someone has in the backdrop of these symptoms developing can vary quite a bit. Let's put it that way. So some people just have life circumstances that are a little difficult. Some people have long-standing habits and patterns of responding to things in ways that make stress a lot worse. So anxiety and anxiety type patterns, obsessive compulsive thinking patterns that can really ramp things up. But also habitual patterns of behavior that people will often think of as personality traits, but I don't. I think of as strategic, like people pleasing and perfectionism and being super conscientious and like the go to person. Those things also tend to not just amplify new stress, and I can give examples if that's helpful, but also create their own stress. So this person ends up with an inordinate outsized load of stress. So when the symptoms show up, the system is so sensitized that it massively overreacts to the symptoms. And it's not enough in those cases to just react differently to symptoms. We also have to undo some of the stress that's feeding them. So we have to look at someone's habits. We have to look at how someone deals with anxiety and intrusive thoughts. We have to look how someone deals with really their relationship to themselves and other people, because all of those things are making the system so much more sensitive. And then I would say there are also people who are also suffering from post-traumatic stress disorder or severe effects of trauma, whose systems are even more sensitized and rigid. And so for them, behavioral changes aren't enough. We have to get to some of the fundamental worldview that they have, the fundamental beliefs they have about how the world works. And that's what helps undo some of that stress backdrop.